Imagine this microscopic enemy, right? It invades a horse's body, then it can just lie low for years maybe,
Yeah.
and then bam, sudden blindness.
It's quite something.
Or, it hits a pregnant mare, causes a really devastating late-term abortion, sometimes even severe kidney failure, life-threatening stuff.
Yeah.
But here's the really insidious part. A lot of horses might carry this thing, this unseen threat, and show zero obvious signs. It's widespread and incredibly sneaky.
That's right.
So today, we're doing a deep dive into leptospirosis in horses. It's a really fascinating, sometimes, frightening bacterial disease, but super impactful.
Definitely.
Our mission really is to kind of pull back the curtain. What is leptospirosis? How does it affect horses? And importantly, how does it affect us, humans? We'll look at how vets diagnose it, how we treat it, and crucially, how we can build a shield around our horses to protect them. We've got a ton of research expert insights to guide us.
And it's vital. Everyone understands this isn't just like a local issue for horse folks.
Right.
Leptospirosis is everywhere, globally distributed.
Right.
And the really critical piece, it's zoonotic.
Meaning?
It can jump from animals to humans, which makes it hugely important, not just for horse health, but for public health in general.
Okay, let's unpack this then, starting at the beginning. What exactly is leptospirosis? Where does this bug come from?
Okay, so at its core, it's a bacterial disease. It's caused by these spiral-shaped bacteria, like tiny little corkscrews from the genus Leptospira.
Spiral-shaped.
Yeah. And technically, they're gram-negative. That just refers to their cell wall structure, and they're motile. They can swim around quite well.
They move.
They move. And that ability to move, plus their general toughness, means they can survive for a pretty long time in moist places. Think wet soil, stagnant water, puddles after rain.
So it's not just one single type of Leptospira then. Are there specific ones we worry about more in horses?
Precisely. That's a key point. There are loads of different types. We call them serovars. Horses can get sick from many of them. But in North America, the one we see causing the most clinical disease is Leptospira interrogans serovar pomona. Specifically, a type called Kenowicki.
Pomona kenowicki.
Yeah.
Yeah.
You might also hear about Leptospira cushioneri serovar gruppotifosa. That one pops up too. So yeah, lots exist, but those are the main ones on our radar for horses here.
Okay, so how does this microscopic corkscrew actually get into the horse and start causing problems?
Right, so it usually gets in through mucous membranes, eyes, nose, mouth, or maybe just a little cut or scrape on the skin, abraded skin. From there, it spreads fast. It uses the lymphatic system to get into the bloodstream. That phase is called bacteria in the blood.
Circulating everywhere.
Pretty much. And once it's circulating, it can invade different organs. Kidneys, liver, if it's a pregnant mare, the placenta and the fetus, and also the eyes. Now, here's the really clever or, nasty part. While the horse's immune system usually clears the bacteria from most places, Leptospira can hang out, persist, in what we call immune-privileged sites.
Immune-privileged, like the immune system can't get to them easily.
Exactly. Places where the immune response is kind of toned down naturally. The big ones are the kidneys and the eyes.
Oh, okay.
And the kidneys are the most common hideout. This leads to a really critical concept. The carrier state.
The carrier state, right?
Think about it. A horse can look perfectly healthy, totally fine, but be silently shedding these bacteria in its urine for months, even years sometimes.
Wow, a walking biohazard, basically.
Essentially, yeah, it's lepto's stealth mode. Makes it incredibly difficult to control because you don't always know who's infected. It's a constant hidden source.
Which leads us right to how it spreads. If it's being shed in urine, I'm guessing contaminated water is probably the biggest issue.
You got it. The main way it spreads is indirect contact. So an infected animal could be wildlife like raccoons, skunks, deer, rodents, or another infected horse pees, sheds the lepto. That contaminated urine gets into water sources, ponds, puddles, maybe floodwater, or even contaminates feed or soil. Then another horse comes along and drinks that water or eats that feed.
Okay.
Direct contact is less common, but possible maybe from touching a contaminated placenta after an abortion. And a really significant route, especially for breeders, is vertical transmission, an infected mare passing it directly to her unborn foal.
Okay, this is where, for me, it gets really interesting and, frankly, a bit alarming, too. We know what this bug is, how it gets in, but what does it do? The symptoms sound so varied.
They really are. And that's why it's often called a master of disguise. Many infections, maybe even most, are subclinical. The horse never looks sick.
Right, the silent carriers we talked about.
Exactly. But when it does cause clinical signs, the effects can range from subtle to truly devastating.
So what's the most common thing horse owners might actually see?
Probably the most common and certainly the most well-known sign is equine recurrent uveitis, or ERU. Lots of people know it as moon blindness.
Moon blindness, right, I've heard of that.
Lepto is thought to be behind a really significant chunk of ERU cases, and here's the really insidious part about the eye connection.
Yeah.
It's often an immune-mediated thing. The initial infection happens maybe weeks, months, even years before.
Years.
Yes, potentially years. Then the immune system's reaction to leftover bacterial bits or maybe altered eye tissue causes this chronic relapsing inflammation inside the eye. It's like a microscopic time bomb.
That delayed fuse is
Yeah.
terrifying.
Yeah.
What does an acute flare-up of this moon blindness actually look like? How would you know?
An acute episode is usually pretty obvious and painful for the horse. You'll see intense eye pain, squinting hard, that's blepharospasm, lots of tearing, epiphora, they'll hate bright light photophobia.
Okay.
The eye itself will look red, inflamed, conjunctival hyperuremia. The cornea, the clear front part, might get cloudy or hazy, that's corneal edema. Inside the eye, the fluid might look murky, we call that aqueous flare. Sometimes you can even see pus, that's hypocorneon, or blood, hyphema, settling in the bottom of the eye chamber. And the pupil is often constricted, very small, that's meiosis.
Sounds awful. And if it keeps recurring?
That's the danger. These chronic recurrent episodes lead to permanent irreversible damage. Things like cataracts, glaucoma, high pressure inside the eye adhesions where the iris sticks to the lens or cornea, that's synechia. The gel inside the eye can degenerate, and ultimately, yes, it often leads to complete blindness in that eye.
Just devastating. Okay, beyond the eyes.
Yeah.
You mentioned abortions in pregnant mares.
Yes, absolutely. Leptospirosis is a major cause of late-term abortions, usually in the last trimester of pregnancy.
How does it cause that?
It causes inflammation of the placenta placentitis, and it infects the fetus directly. The placenta itself might look really abnormal, kind of swollen and boggy, edematous, or have dead patches, necrotic areas.
And the foals?
Heartbreakingly, the foals might be stillborn. Or if they're born alive, they're often very weak, struggle to survive, and can be jaundiced, have that yellow tinge to their skin and gums.
Oh, man. Okay, what else? Kidneys.
Yes, another major target is the kidneys. It can cause acute renal failure. This happens with an acute systemic infection, and it seems to be particularly severe in foals.
What are the signs of kidney failure?
You'd see things like fever, the horse being really depressed, off its feed, maybe signs of colic. And then the classic kidney signs, sometimes they drink and pee excessively, polyuria, polydipsia. Or if it's really severe, the opposite, they might produce very little urine, oliguria, or none at all anuria. It can come on fast, be very severe, and sadly, can be fatal.
Wow.
And then there's just general acute systemic illness. It's actually less common for horses to show really severe knockdown systemic signs compared to, say, dogs or cattle.
So more subtle.
Often, yes.
Yeah.
You might just see a low-grade fever, the horse seems a bit down, listless, maybe not eating well, some muscle soreness, maybe mild jaundice. The tricky part is these signs might resolve on their own, but the horse might then become one of those chronic carriers we talked about, shedding the bacteria silently in its urine. So the acute phase might pass unnoticed, but the horse remains a source of infection.
Sneaky again. And I think you mentioned briefly sometimes liver issues or respiratory signs, though less common.
That's right. Occasionally, hepatic disease or respiratory signs can be part of the picture, but they aren't the primary things we usually see.
It really highlights that huge range of signs, doesn't it? And especially that delayed onset for ERU.
Yeah.
It's kind of an aha moment when you connect the dots, one infection causing blindness years down the line.
Exactly. And we absolutely have to talk about the zoonotic potential.
Right, the risk to people.
Yes. Leptospirosis is a serious zoonotis. Humans can get infected. Usually it's through direct contact with urine or tissues from an infected animal, or indirectly, like through contaminated water or soil getting into cuts or scrapes or splashing into your eyes or mouth.
What does it look like in people? Is it serious?
It can be very serious. Initially, it might just seem like the flu fever, headache, muscle aches, maybe vomiting or diarrhea. But it can progress to severe stuff like Weil's disease, which involves kidney and liver failure, jaundice, or even severe lung problems like hemorrhagic pneumonia. It can be fatal in people.
That is incredibly serious. So for anyone listening who works with horses, veterinarians, technicians, owners, immediate precautions.
Absolutely crucial. Always, always wear personal protective equipment. Gloves are essential. Eye protection, too, if you're handling anything potentially contaminated. That means urine, aborted foals, placentas, even just tissues from a suspect animal. And
Hmm.
basic hygiene is paramount. Wash your hands thoroughly after any contact. Don't eat or drink around potentially contaminated areas.
Okay, really important advice.
Mm.
Now, given all this, the sneaky nature, the silent carriers, the varied signs, diagnosing it sounds like a real challenge for vets, like putting together a puzzle.
It absolutely can be. Diagnosis often starts with just clinical suspicion. A horse comes in with ERU, especially if it's recurring.
Moon blindness.
Right. Or there's an unexplained late-term abortion, or maybe acute kidney failure, especially in a foal. Those are big red flags. Also, just the horse's history. Has it been exposed to stagnant water? Is there a lot of wildlife around? That all factors in.
So once the suspicion is there, how do you actually confirm it? What's the go-to test in the lab, the gold standard?
The microscopic agglutination test, usually just called the M, is considered the gold standard serological test. It looks for antibodies in the horse's blood serum against different leptospirobars.
Okay, antibodies. So it tells you if the horse has been exposed.
Exactly. But interpreting it needs care. A single high titer, say 1.400, 1.800, or even higher, suggests exposure, yeah. But it doesn't automatically mean the horse has an active infection right now or that lepto is definitely the cause of the current problem.
Why not?
Because many perfectly healthy horses, especially in areas where lepto is common, can have high MAT titers just from being exposed sometime in the past, maybe without ever getting sick.
Huh. So a high number isn't proof. That sounds confusing for vets trying to make a call.
Yeah.
How do they deal with that uncertainty?
It is a challenge. That's why, for a truly definitive diagnosis using MAT, what you ideally want are paired samples. You take one blood sample when the horse is sick, the acute phase, and another one 2 to 4 weeks later, the convalescent phase.
And compare them.
Exactly. If you see a 4-fold or greater rise in the antibody titer between those two samples, that is diagnostic. It proves the horse's immune system is actively responding to a recent lepto infection.
Okay, that makes sense. What about in specific cases, like ERU or abortion? Is the interpretation different?
Yeah, it can be. For ERU, because it's immune-mediated and often delayed, finding a very high MAT titer, often 1.8N0 or higher, especially to L. pomona, in a horse with clinical signs of ERU is considered highly suggestive, even if you don't have that rising titer. The timing is just different. And for abortions, finding very high MAT titers in the mare serum and in fluids from the aborted fetus is usually considered diagnostic.
Okay, so Matt looks for the immune response. Is there a way to look for the actual bacteria, like its DNA, to say, yes, lepto is definitely here right now?
Yes, there is. That's where PCR comes and a polymerase chain reaction.
PCR, okay.
PCR directly detects the DNA of the Leptospira bacteria. So a positive PCR tells you the organism is actually present, indicating an active infection or carrier state.
What kind of samples do you use for PCR?
The sample choice is really important. Urine is often the best bet for finding those chronic carrier horses that are shedding the bacteria. PCR in urine is often more sensitive than trying to culture it.
Okay.
For ERU, you can actually test the fluid from inside the eye, the aqueous or vitreous humor. A positive PCR there confirms lepto is, or was recently, inside the eye. For abortions, PCR on tissues from the aborted fetus, like kidney or liver, and the placenta is critical. It directly confirms lepto was involved in the abortion.
And blood.
Blood can be useful for PCR very early in an acute systemic infection, like in the first week or so. But the bacteria don't stay in the blood for long once the immune response kicks in, so blood PCR becomes less sensitive later on.
So just to clarify, Matt looks for the evidence the horse fought it off, the antibodies. PCR looks for the actual bug itself, its DNA.
That's a great way to think about it, yeah. One is the footprint, the other is the foot.
Gotcha. And you mentioned culture briefly. Is that common?
Not really for routine diagnosis. Trying to culture Leptospira to grow it in the lab is actually really difficult. It needs special food, special conditions, takes weeks. It's just too slow and finicky for most clinical situations. PCR is much faster and often more sensitive, especially for urine.
Okay. And then I assume other tests help fill in the picture, like eye exams for ERU, kidney blood tests for renal failure, maybe even post-mortem exams if a horse dies.
Exactly. It's often about putting all the pieces together, the history, the clinical signs, and the specific lab results.
All right, so let's say the detective work pays off, you get a diagnosis. How do you fight back? What's the treatment plan against such a tricky opponent?
Treatment really depends on what's going on. Is it acute kidney failure? Is it ERU? Is it just trying to clear a carrier state? How severe is it?
Makes sense. But is there a core treatment against the bacteria itself?
Yes, absolutely. The cornerstone is antimicrobial therapy to kill the bacteria. Starting antibiotics early is really important. It helps eliminate the organism, reduce the severity of the illness, and crucially, helps prevent the horse from becoming a chronic carrier shedding the bacteria.
What antibiotics work best?
The go-to drugs are often penicillins, like procaine penicillin G given intramuscularly, or sometimes sodium penicillin G intravenously, especially for acute infections. Tetracyclines are also very important. Oxytetracycline intravenously can be used in the acute phase, and doxycycline, which can be given orally, is often considered particularly good for clearing Leptospira from the kidneys, tackling that carrier state.
Are there others?
Yeah, drugs like ampicillin, amoxicillin, ceftriaxone, cefotaxime, even the zithromycin have shown effectiveness. The vet chooses based on the situation.
How long do they need treatment?
Usually for a decent length of time, typically 2 to 4 weeks, sometimes even longer. You really want to be sure you've eliminated it, especially from those kidney hideouts.
I remember reading about something called a Jerisch-Herxheimer reaction. What's that? Is it common?
Yes. That's definitely something to be aware of. The Jerisch-Herxheimer reaction is basically a temporary flare-up, a worsening of clinical signs that can happen shortly after starting antibiotics, especially for spiral-shaped bacteria like Leptospira.
How does it happen?
It's thought to be caused by a massive sudden die-off of the bacteria, releasing a flood of toxins or inflammatory components all at once. It can cause a temporary spike in fever, maybe the horse feels worse for a day or so.
Is it dangerous?
It's usually not life-threatening in horses, but it can be alarming if you're not expecting it. So vets usually warn owners it's a possibility. It doesn't happen every time, but it's good to know about. It usually resolves pretty quickly as treatment continues.
Okay, so antibiotics are key. What about supportive care for the specific problems lepto causes, like the kidney failure or the eye inflammation?
Absolutely essential. For acute systemic illness or kidney failure, supportive care is critical. That means aggressive intravenous fluids, 5 drips, to rehydrate the horse and support kidney function. Sometimes diuretics, like furosemide, are used to help stimulate urine production if the kidneys are shutting down. And NSAIDs, non-steroidal anti-inflammatories, like Flunix and Miglumin, are vital for controlling fever, pain, and inflammation.
What if the kidney failure is really bad?
In very severe cases, the horse might need referral to a specialized hospital for intensive care, potentially even dialysis, although that's obviously a very advanced and costly option.
Okay, and for the eyes? For ERU?
For equine recurrent uveitis, the focus is on controlling that inflammation aggressively, especially during a flare-up. This usually involves both topical treatments applied directly to the eye and systemic medications.
What kind of topical treatments?
Potent topical corticosteroids like eye drops or ointments containing dexamethasone or prednisolone acetate are mainstays for reducing inflammation inside the eye. And this is a huge BUT. They absolutely should not be used if there is a corneal ulcer, a scratch, or wound on the surface of the eye. Steroids can make ulcers much, much worse, potentially leading to rupture, so the vet has to stain the eye first to check for ulcers.
Okay, crucial point. What else for the eye?
Topical atropine is also commonly used. It dilates the pupil, which helps reduce pain from muscle spasms inside the eye, and it also helps prevent the iris from sticking to the lens, those synechia we talked about. However, atropine can potentially slow down gut motility, so you have to monitor the horse closely for signs of colic.
Right, and systemic meds.
Yes, systemic NSAIDs like flunixin or phenylbutazone, bute, are given orally or by injection to help control pain and inflammation throughout the body, including the eye.
Now, what about that idea of injecting something into the eye for lepto-related ERU? That sounded pretty advanced.
Yes. That's really interesting stuff. For persistent ERU cases where lepto is strongly suspected, some veterinary ophthalmologists might consider a single intravitreal injection. That means injecting directly into the vitreous gel inside the eyeball of a very low dose of the antibiotic gentamicin.
Wow. Why gentamicin?
The idea is to try and kill any residual Leptospira organisms that might be hiding out inside the eye, triggering that chronic inflammation.
Does it work? Are there risks?
It can be effective in some cases at reducing the frequency or severity of ERU episodes, but it absolutely carries risks. Potential complications include damage to the retina or optic nerve, which could worsen vision. So it's a specialized procedure, requires a skilled ophthalmologist, and involves very careful discussion with the owner about the potential benefits versus the risks.
Are there other options for chronic ERU?
There are surgical options, like implanting a tiny device under the outer layer of the eye that slowly releases an immunosuppressive drug like cyclosporine. This helps manage the inflammation long term, but it doesn't directly kill any remaining leptobacteria. It just controls the immune response.
Okay. And for the mares that suffer an abortion, what's the treatment there?
Sadly, for the abortion itself, once it's happened, there's no direct treatment to reverse it. The focus really shifts to management of the mare and preventing future abortions in the herd. That involves things like environmental cleanup, vaccination protocols, and definitely isolating the mare that aborted to prevent spreading infectious material.
Right. Which brings us squarely to prevention. Given how devastating lepto can be, blindness, abortion, kidney failure, even death, and how sneaky it is, prevention seems absolutely critical. What can horse owners actually do?
It really is paramount, and it starts with environmental management. Try to prevent horses from drinking from risky water sources, stagnant ponds, puddles, slow streams, especially if wildlife has access. Fencing off those areas can be really helpful.
Makes sense. What else?
Controlling wildlife access to pastures, barns, and especially feed storage areas is important. Rodent control is key too. Improving drainage in wet, muddy areas can reduce places where lepto can survive. If there are floods, move horses to higher, drier ground if possible. And good general hygiene, like proper manure management, also plays a role.
All sounds like good husbandry. What about a vaccine? Is there something we can give the horses directly?
Yes, thankfully there is. There is a USDA-licensed vaccine available. It's called Lepto-EQ Innovator, made by Zooetis.
What does it protect against?
It specifically targets Leptospira interrogans serovar pomona, which, as we said, is the main one causing clinical problems in North America.
Who should get this vaccine?
It's generally recommended for horses considered at risk. That could be horses living in areas where lepto is known to be common, horses with significant exposure to wildlife, or horses on farms that have had issues with ERU or lepto abortions before. Importantly, it is labeled as safe to help prevent lepto-induced abortions in pregnant mares.
Can foals get it?
Yes, foals can start the vaccine series from 6 months of age.
What's the schedule like?
The initial series is 2 doses, given 3 to 4 weeks apart. After that, it's typically an annual booster.
Are there limitations? Does it protect against everything?
That's a really important point. It's only for L. pomona. It won't necessarily protect against other serovars like Grippa typhosa, though pomona is the most common issue. Also, it's a killed vaccine, a bacterin. While it's shown to reduce the severity of disease, reduce shedding of bacteria in urine, and help prevent abortions caused by pomona, its exact duration of immunity or its effectiveness against all potential outcomes, like ERU, might still vary. It's a tool, a very useful tool, but not necessarily a perfect shield against everything.
Okay, good to know. So environmental control, vaccination. What about just general biosecurity and dealing with that carrier state? That still seems like a huge hurdle. The horse that looks fine, but is spreading it.
Absolutely. Good biosecurity practices are vital. If you suspect a horse has active lepto, especially if it's aborted, or has acute signs, isolate it from other horses immediately.
And personal protection.
Yes, reinforcing what we said earlier, always use gloves and eye protection when handling potentially infectious materials like urine, fetal membranes, or aborted foals. Dispose of those materials safely, and thoroughly clean and disinfect any stalls, equipment, or trailers that might have been contaminated.
And managing those silent carriers. Is testing urine by PCR the main way?
That's currently the best approach we have for identifying carriers. Testing urine by PCR can tell you if a seemingly healthy horse is shedding Leptospira. Identifying these carriers allows for specific management, maybe treatment to try and clear the shedding, and helps prevent them from being an unknown source of infection for other horses and potentially for people too. It's all about breaking that cycle of transmission.
Wow. Okay. So recapping here. From blinding eye conditions that might not show up for years to causing late-term abortions, severe kidney damage, leptospirosis is clearly, well, it's a really complex, widespread disease. Huge impact on horses, and that serious zoonotic risk to humans is always there. It really hammers home the need for combining good diagnosis, the right treatment, and really proactive prevention.
It really does. And this raises a really important question, I think. When you consider how widespread lepto is, how often it might be hidden, lurking subclinically, and yet it has this power to cause such delayed, chronic, severe problems. What does that really tell us?
What do you think it tells us?
I think it tells us about the absolute need for constant vigilance in managing our horse's health.
Mm.
We need comprehensive strategies, not just reacting to problems, but actively preventing them. And it highlights that deep interconnectedness, doesn't it, between animal health and human health, that whole one health concept. What affects our horses can, sometimes quite directly, affect us.
That's a powerful thought. Constant vigilance and understanding that connection.
Exactly. So the take-home message is really to stay informed, be aware of the risks in your area, talk to your veterinarian about prevention strategies like vaccination and environmental management, and don't hesitate to get things checked out if you see concerning signs.